Hello, welcome to a catch-up session from a third-year medical student. So, my name is Monica. I am a medical student in Washington, D.C. I'm in my third year of med school, and today I'm going to talk about how third year is going and how life has been since finishing step one earlier, like around this time last year. So, essentially, ever since I got done with step one, we instantly went into rotations. So I did my surgery rotation, I did family medicine, psychiatry, neurology, internal medicine. I'm currently on OB-GYN, and then I end with pediatrics. I'm pretty sure I missed some rotation in there somewhere, but that's essentially what my schedule looked like. It's kind of wild that it's towards the end of the third year because I feel like so much has happened. Life has changed so much. I've changed so much. And being exposed to all these specialties, you forget how much you've seen, how much you've grown. And also you take shelves, which are these exams for each of the specialties throughout the way. So it's been a lot's been going on, which is why I feel like I've also had a harder time filming and staying consistent with YouTube. But I'm hoping this is the year because I'm also taking a research year. So I'm hoping that this year gives me a little bit more time to focus on YouTube. But yeah, so that's kind of what's been going on so far. Today is Thursday. I just got done with one of our early morning lecture things, and we have another one from 10 to 12 in 8 minutes. So I'm just sitting here drinking some coffee and having some breakfast, and I'm trying to finish some Anki, which is this flashcard thing that we use a lot in med school. And then for the rest of the day, I have clinic at 1, so I'm going to eat a really quick lunch after lectures and then head to clinic. Alright, just wrapped up lecture. It's a whole bunch of STIs and pelvic inflammatory diseases and tubular ovarian access and a whole bunch of that. But we wrapped up a little bit early, which is great. I'm gonna eat lunch in about 20 minutes, but just wanted to talk for a few minutes because I feel like, I don't know, I just haven't chatted in a while. So I'm on my OB-GYN rotation, like I mentioned, and it's been a lot. I feel like OB-GYN is definitely one of the, I'm glad it's towards the end because the schedule is just really weird. You see surgery for a big part of it, and then you see a lot of clinic. At least that's how my schedule is. I did GYN surgery, so I saw a whole bunch of hysterectomies and hysteroscopies and all of that stuff. And then now I'm doing I'm towards the end of my 2 weeks of clinic. So I saw kind of bread and butter OB-GYN, a whole bunch of prenatal visits, postpartum visits, IUD placements, removals, all of that, fibroids. Oh my gosh, so many fibroids. And then now I'm going to be starting on labor and delivery starting this Sunday. So I do my week of nights, which I have never done nights before in med school. So I am a little bit scared of how I'm just gonna stay awake because our schedule is 7, oh my battery's dying. Our schedule is 7 p.m. to 7 a.m. And I'm literally, I can't, I don't know how my body's gonna react. So it's gonna be an adventure. But yeah, OB-GYN's been a lot, but I feel like I've learned so much about women's health and also how little we know about women's health. I feel like I've kind of seen it all, learned so much about it, and also how much need there is to learn more about it just as a society, and as science in general needs to catch up to how much there is to study in women's health. But it's been really nice. But yeah, okay, so for the next 30 minutes, I'm gonna do some more Anki and then eat lunch, get ready for clinic, and then head out. So I got back from clinic like 5 minutes ago, saw a ton of patients and then had a meeting, and now I'm back. And I have some tea, and we're gonna talk about what's been going on for the past year. And what my thoughts were on like all the specialties I've rotated through and kind of where my head's at right now. So third year med school is very different than the first 2 years of med school. I feel like I wish I had known that, and maybe a part of me did, but really nothing prepares you for it unless you're going through it or you know someone like very, very close that you're experiencing it with or through. So, like I said, I started my third year pretty much like immediately after taking step 1. Like we had about 2 or 3 weeks of some like random lectures and I don't even know. And then we started, and then I started with my surgery rotation. And surgery was a lot. I think the hardest part about surgery was the hours, because you're just kind of in surgeries for like 10 hours a day, give or take a few hours based on what rotation you're on. So for my surgery block here, let me pull up, I'm just pulling up all my rotations because I kind of forgot a lot of my surgery rotations. And like just like a lot of my rotations in general, so I'm hoping seeing like a list of them will like bring back memories. Okay, so I started surgery with ENT for about 2 weeks, and that was a really good, I think, intro to surgery because it's like a subspecialty within the surgery world. And I had some great residents that I worked with. They like really walked me through a lot. Like I remember my first week, the chief sat me down and was like, this is how you organize your you know, the software that we use, like our electronic health record system. He's like, this is how I would organize it, this is what I look for, this is what you do. And he was just really, really nice. So ENT was a great start. I then did ophthalmology, and that was also really, really nice. I feel like I really liked my ophtho rotation. I loved all the people that I worked with, and I just like noticed, and again, this is maybe such biased information and my own biases as well, but like anyone that I've worked with in ophthalmology has just been some of the nicest people that I've worked with and gotten to know. Next is urology, which was very cool. I don't know if I necessarily jive with the specialty and the work. I did do a few days in like Urogyn clinic, and I thought that was really, really good experience because I don't know, you just like, I got to see, I didn't even know that you could go from like urology into gynecology. I didn't know that there was a specialty which essentially kind of combined both of them. I then did breast surgery, and that was also very good. And also breast surgery was one of those ones where I got to do a lot. Like I got to like stitch up or like do the last few stitches, like just stitching up the skin. So I really got to practice a lot of my like suturing, and absolutely loved breast surgery. And then I ended with endocrine, which was my like gen surgery like requirement. So it was 4 weeks of endocrine, and that was, I want to say, I think my hardest rotation. And you wouldn't think it, but our endocrine is very, very surgery heavy. Oh my goodness, we had cases all day, every day. It was a lot. And yeah, that's how I ended my surgery block. So with surgery, your hours are like essentially like 5 to whenever they let you go. And you know, you would come in the morning to pre-round on the patients that you saw procedures for that day, or like the day before. So you'll pre-round on them, which is essentially kind of what all the memes are about. I don't know if you guys have seen them, but it's like you're waking a patient up at like 5 in the morning to be like, did you poop yet? And that was essentially my job. And yeah, so surgery was an experience and a half. The hours were really long, but we do a lottery system in our school to kind of figure out our schedule. And I'm so glad I got surgery first, because the idea of doing surgery now or at any point later on in my third year would be crazy, because I feel like I had the energy and honestly just like the ignorance to like go through surgery when I did, like initially in my third year. But right now I could not do it. I could not do it. They did family medicine, and family medicine was, I think, the closest that I felt to a real doctor. And not to say that, what I'm trying to say is that I got to see my own patients. I got to like essentially present my patients, come up with a plan. Like it was such a good experience in that way. And like bread and butter medicine, I got to like look at diabetes management, hypertension, hyperlipidemia, proteinuria, like all of this stuff. I really enjoyed family medicine. And it was kind of in like an outpatient clinic. Like my site was an outpatient clinic, and I just really enjoyed it. And again, family medicine had some of the best residents. I just like learned a lot on my family medicine rotation. So that was about a month. Then I did psych, and psych was, I think my experience with psych was very different than a lot of people's, because I did like what is it called? Partial hospitalization. So it's not inpatient, it's outpatient. It's like a step down from inpatient and a step one from like outpatient psychiatry. And I don't know, I didn't even know it existed. And so I got to really like see what kind of patients essentially would require this like intermediate level. And it's essentially like 8 hours of therapy along with like a psychiatrist who manages someone's meds. And yeah, I loved my psych rotation. Just had such a good experience overall. And also the schedule, my schedule was really good for psych. Like I got to have a lot of time not being in the hospital, and that was nice. It was like a nice break from like doing all this like hard surgery stuff. And even family med, the hours were a little bit kind of crazy. So psychiatry was really nice. Again, some of the best people. Really enjoyed it. And then I did radiology as like a selective. So you can like essentially, I think throughout the year we get to pick about 3 selectives. So these are different specialties that are not like our core specialties, but the ones that we can choose to rotate through. And I did radiology for 2 weeks, and that was virtual. So that was like a really nice thing, because for the first time in like months, I got to be at home for like during the day. And that was just, oof. I didn't realize how much I missed being at home rather than just like rushing off to hospital and clinic all the time. And radiology was also just really cool. It's a really good skill to have, to learn. And I don't even think I scratched the surface there. I'm sure I will look at an image and just barely be able to figure out the anatomy, like the normal anatomy, like where even the liver is and the kidneys are and all of that. But I think it was a great experience. Then it was neurology for, I want to say about 2 weeks. Neurology is very surprising in the sense that what you learn in neurology during like your first, like your preclinical years of med school is not how the practice of neurology is. Like it's really hard to, not that you don't learn the proper material, that's not what I'm saying. It's just that you don't expect what neurology is going to be like. And it's really hard to describe. But neurology honestly just felt like a maze for me. Like I think I was just like, so many of the things there are no clear answers for. And I think that's the one I struggled with the most. Because that is so true for so much of medicine, but I just felt like for neurology it was extra true. Like you would get patients where you could not like make heads or tails of their symptoms, and you would see something in the imaging in the brain, but like correlating it with physical findings, it just felt like a maze. Like that's the one way I would describe neurology, maze. And I think some people do really well with it, and I think for me personally, I don't do that well with that much uncertainty and that much like could be this, it could be that. Like I really struggled with that with neurology. Then I did a selective in dermatology, and great rotation. And again, the people just so chill, so cool. And the subject matter was like very interesting. I honestly really enjoyed my dermatology rotation. And then I did internal medicine, and whew, internal medicine was a lot. Internal medicine for us is like, I want to say 8 weeks or something. So it's very long. I had like 4 weeks in one hospital, 4 weeks in another hospital, and then 2 weeks in clinic as like outpatient IM, which essentially was very similar to family medicine. I struggled with IM for a few reasons. I think because the hours are pretty brutal, and it's more like you end up working on the weekends a lot, and so the hours are a lot. The subject matter, like there's just so much information to know. Like there's so much. You could get anything and everything. The learning curve is very steep because I think the expectations that people have of med students in IM is just really the expectations that they had for med students in IM was just much more than any other rotations I'd done previous to this. So it was like a lot of hours, breadth of knowledge, expectations were much higher. The other thing that made IM really hard is, oh yeah, I like, this is true for all the other specialties. Like we are taking exams kind of throughout. So like once we got done with our surgery block, we took an exam for surgery. Once we got done with our family medicine block, we took an exam. It's called these shelf exams. And the IM shelf, there were just so, like we use, a lot of people use these question banks, and there were just so many questions correlating to just how vast and the breadth of knowledge you have to know for IM. So it was a lot. And I also think it was like, I reached that point during my third year, I was just feeling very tired because, you know, you're just like one after another, you keep going. And we had one break. We had one like 10-day break in the middle, but apart from that, it's just kind of like go from one rotation to next. And I think I was just feeling a little bit more tired during IM. So, I mean, the block went well. I actually just got like my comments back from the block today, which is weird. It's like really late to be getting comments back from the original block, but my comments were great. Like I learned a ton, but it was very hard. And whew, I talked a lot. I talked for so many minutes straight. I'm gonna take a sip of my tea. Oh, I got this Japanese, as an aside, I got this Sencha tea, Japanese green tea from Trader Joe's. I'm drinking it and it's so good. I recommend this green tea. Okay, so that was that. Then we had winter break. Finally, that break was so necessary. Like I really needed like a recharge. I think I like emotionally was tired, physically I was tired, just tired all around. So we got like about a 14-day break, which is incredible. I went to India. I saw like family. I ate really good food. Like it was very necessary. And then we came back and it's January, and I am in my OB-GYN rotation. So I did 2 weeks of GYN. I'm like wrapping up clinic today, like I told you guys already, and I'm doing labor and delivery next week. So I'm gonna see a whole bunch of babies being born. But whew, all that talking, just to catch you guys up on what's been going on in the last year. It's been a very busy year. And I just want to reiterate how different third year has been from preclinical. Like preclinical, you had lectures for sure, but a lot of lectures, like attendance wasn't mandatory. So really your time was your own. Like you were studying a lot, but your time was your own and you could kind of dictate when to do what you wanted to do. So it felt like a lot more freedom. And I think third year, what I've struggled with the most is just feeling like not in control of my time. Like when I am assigned to be somewhere, I am there from like the start until whenever they let me go. And I think that's also been the hardest part because you don't necessarily have like, okay, in clinic, I have like a set, the last patient is going to be at like 4 p.m., 4:35, whatever. And even that gets like really dicey because people running late. Some patients end up taking longer than others. So you never, like your end time very rarely is like the end time that you plan for in your head. But then when you have surgeries, like you don't know when you're gonna go home. So it just makes it really hard to plan your life. You're also working weekends a lot of the time. So it's harder to plan things because of that. So I think time has been the biggest factor because not only are you in the hospital a lot, but the second part of your job essentially is to study a lot because we have our shelf exams, and then also step 2, which is our second board exam that we take at the end of our 3rd year, or most people take at the end of their 3rd year. So the pressure for studying is kind of always constant and always there. So I think that's what makes 3rd year particularly challenging. Long hours, really no sense of like autonomy over your time, and then just constant stress of study. Okay, so I talked a lot about how hard 3rd year can be and how challenging it can be, but there's so many positives as well. You learn so much during 3rd year. Like, you actually learn how medicine is practiced, and I think there is no like shortcut to that. It's invaluable experience. And I was talking to somebody the other day, and they described it as like almost like talent stacking or like skill stacking, where like every rotation you're like building on your skills and you're adding a skill on top of your skills. So doing a full like psychiatric history and being able to come up with a differential, and then doing family med, and then being able to do a full physical exam, and then neurology and doing a full neurological exam, and then you're adding an OB-GYN exam. So everything is like building on top of one another, and it's really hard when you're in the thick of it to like realize how far you've come. But I've had moments where I'm like, wow, I know so much more now than I ever did in the beginning of 3rd year or at any point during my first 2 years. So, and obviously I know so little compared to like what I'm going to learn going forward, and what all the residents and attendings, and there's always more to learn for sure. But it's also really important to acknowledge like how far I have come and how much essentially 3rd year prepares you for, you know, a career in medicine, and also just like how much knowledge stacking and abilities you gain as you go through 3rd year. And I think for me personally, the most valuable part has been like figuring out what I like and what I don't like what I want in my future career, what I don't want. Do I want to be in a hospital? Do I want to be in the OR? Do I want to be in a clinic? Do I want like what I want out of my career and my life? Like, that has been so good to learn, and just like such good information to have on myself. And that's a whole video for next time, and let me know if you guys want me to talk about that. But I just think that there is no real way to figure that out unless you go through some form of like clinical rotations and your 3rd year of medical school. So I think with that, I will wrap up today's video. I talked a lot, but I feel so good about catching you guys up with kind of what's been going on with me the last year, and honestly why it's been a little bit silent on this channel, because I think I've honestly just been trying to stay afloat and like find my bearing. And every time I get comfortable in a rotation or in like a particular site, I feel like I'm switching over to something else and switching it over to like a new site, new group of people, and having to learn everything from scratch all over again. So that's why I think I've had a little bit less time for my hobbies and other things that make me happy. But now that 3rd year is wrapping up, I do really want to continue documenting this journey, because I think it's like such a, well, it's unique to everybody. So I want to document my journey in medicine and like life in medicine, and how I've been navigating kind of the ups and downs. If there are any specific topics you guys want me to talk about, please leave them below. I am more than happy to do a video on it, or even just like answer in the comments. But otherwise, I hope you guys are doing well, and I'll talk to you guys next time. Bye.